Hi, my name is Robyn Meyers and I teach the corrective exercise course with Great Lakes Seminars. Have you ever stopped to consider what type of communication is really important with our patients and what good communication looks like? It starts there and ends there. Are you on the same page? Are you building rapport? Do you feel like your questions are meaningful and they make sense to the patient? My challenge to you today is to try to include more open-ended questions that forces the patient to think a little bit harder. What are they feeling? What's activating? What specifically is sore? Describe their pain instead of the leading questions. Opening up with, your test, treat, retest. Is that position worse, better, or the same than it was before? And opening up with the worse to give the patient a little bit more bandwidth to agree that it really didn't help. A lot of patients say, I don't know. And my trick is if they say, I don't know if it got better, it means no, it wasn't noticeable. So then go into more specifics, like what specifically feels better? What changed? What's your discomfort level? Describe it. 0 to 10, what's the intensity like? The more that you know about them and have a mutual understanding and map with them, the easier your communication will get. The patient loves it. They feel like they're being heard and seen, and we're not putting a bias out there. When you ask a patient, is that better? Unfortunately, that's a little bit of a bias, and we all fall into the trap. Is that better? We want it to be better. We want them to feel better, and they want to tell us better. But at the end of the day, sometimes we're leaving a little bit of information on the table. What changed? What improved? What's better or worse? And really ask them. When they're doing an exercise, what do you feel working? Where do you feel it working? And we all feel something differently. It'll give you more feedback to determine what the next step could be. And creating that buy-in through that communication and developing the treatment plan with that test, treat, retest will be really critical to improve your patients much quicker when they feel seen and heard and you know exactly what they mean. Tell me specifically what that means. Describe that a little bit more. What goals do you have? Instead of us giving them a list, let's really make our patients think and be part of the treatment plan. Hope this helps.